Mute yourself?
No. We're going to go live in 2 seconds. Hold on.
Okay.
Okay. So do you hear me correctly, Nikhita?
Yeah, I can hear you. Am I audible to you?
Yes, it's wonderful. Now, no, give me just 1 second.
Okay.
My husband will verify that the sound is good on Facebook, and then we can start.
Sure.
Very happy to be with you tonight.
Thank you.
Thank you.
Just sharing my experience with you.
Yes, and thank you for accepting our interview.
It's my pleasure.
Le son est parfait? Parfait. Okay. So, Dr. Nikhita Maini, I will introduce you before we start this interview, if it's okay with you.
Sure, go ahead.
Thank you. And we'll make sure to do like short sentences because I'll translate in French as we go because we have 2 Facebook pages, one English and one French.
Okay.
Merci. Donc, bonsoir tout le monde. J'espère que vous allez très bien. Ce soir, j'ai le plaisir de recevoir la docteure ayurvédique Nikhita Maini, qui est basée au Mississauga, en Ontario. Et je vais juste vous briefer sur la bio. Donc, Dr Maini a une expérience de 15 ans en service ayurvédique et notamment une expertise au niveau des tout ce qui est thérapie par les herbes traditionnelles en Ayurveda, en médecine ayurvédique, et également elle s'est intéressée beaucoup sur le focus de tout ce qui est rasayana, donc le rajeunissement, et panchakarma, qui est la détoxification en Ayurveda. Et également, elle est bachelière en médecine ayurvédique et chirurgie, et elle a une maîtrise en Ayurveda. So I will translate that in English and then let you add some words if you want. Alors, Dr. Nikhita Maini, whom I have the pleasure to interviewing tonight on the subject of diabetes, has expertise in traditional herbal Ayurveda, and she combines herbal Ayurvedic conservative therapies with a focus on rejuvenation and Panchakarma, detoxification, and Ayurveda treatments. To make it short, but it's quite an extensive bio, and it will accompany our life tonight. But she's a Bachelor of Ayurveda Medicine and Surgery, and she also has achieved a Master's MD degree in Ayurveda. So, and you have patients from all over the world.
Yeah.
So you're based in Mississauga, Ontario, correct?
No, I am now in Oakville, Ontario.
Oh, Oakville, Ontario.
Yeah.
Perfect. So, alors elle est à Oakville, en Ontario. And anyone could have you as their doctor, correct?
Yeah.
Because you do by Zoom or Skype or from afar.
I did online consultation also.
OK, perfect. Donc, elle fait des consultations en ligne sans aucun problème. So, do you want to add something before we move into the questions and before I put in the context why I was curious about diabetes?
Okay, I'm fine because I just want to add this that it's been now 15 years that I am practicing Ayurveda, and out of that, it's been 9 years in Canada now.
Wow.
And yeah, it's a very enriching experience to have the patient from North America like from US and Canada, because, you know, here what I'm doing is that my work is focused on privileging the traditional Ayurveda knowledge to provide care for the patient, you know, and the treatment with which I structure is based on the diet and nutrition correction also for the physical and mental well-being.
Perfect.
Yeah.
Donc, Dr Maini me disait que ça fait de ces 15 années en pratique, ça fait maintenant 9 ans qu'elle exerce au Canada. Prior to the 9 years, you have spent them in India, correct?
Yeah.
Donc, avant ces 9 années-là, elle a été en Inde et elle met beaucoup d'emphase sur l'alimentation et tous les rituels de style de vie de base pour être dans un bien-être. Donc, maintenant. So let me just put the context for everyone here tonight. I was interested to have you on to talk to us about diabetes because I was looking at some stats recently, and everybody I came across, and I'll translate my question in French before you go, if it's okay, just so I don't forget. At 54, the memory is not the same. And everybody I had been discussing with lately, it seems like many diabetes is on the rise, and I wanted to research that and thought to myself, am I imagining this, or this is really like, wow, spiking? And so in Quebec, in the province of Quebec, 1,200,000 people have diabetes, and out of that number, 90% type 2 and 10% type 1 diabetes. So, and the risk factors are like kind of, like I find them easy to get into those risk factors. Like I was looking at heredity, but also age, your weight measurement, like your, how do you say that? Not the weight measurements, but the size of the weight. Yeah. The ethnicity, the high pressure. If you're a man, there's more chances for you to get it than if you're a woman. So this is kind of easy to have as a disease. So let me just translate it in French, and I would like, as a first question, to know, how does Ayurveda explain this modern disease, or is it a modern disease for Ayurveda? So let me just translate that. Alors, au Québec, est très content de faire cette entrevue-là avec tout le monde. Je parlais récemment avec des gens et de plus en plus, je me disais, mais il me semble que le diabète est partout. Et je ne comprenais pas ça, puis je m'intéresse de plus en plus, comme vous le savez, à l'Ayurveda clinique, et puis je suis allée voir des statistiques, et 1,2 million Québécois sont atteints. Mes statistiques datent, il y a des statistiques pour le Québec, ça, de 2015, mais 1,2 million Québécois auraient le diabète, et de ce chiffre-là, 90% le diabète type 2 et 10% le type 1. Et je disais au docteur Maini, je disais, mais c'est des risques, je trouve, qui sont faciles à avoir, si on peut l'expliquer comme ça. Tu sais, quand on regarde, le risque augmente en âge, il y a l'hérédité, le tour de taille. Dès que notre tour de taille augmente, hein, il y a des risques qui sont accrus. Donc, on sait que dans les dernières années, ça n'a pas été facile. La pression élevée, c'est un symptôme qui rend le diabète, qui favorise l'apparition du diabète lorsqu'on est un homme. Donc, l'origine ethnique, donc tout ça a fait en sorte que j'ai voulu faire cette entrevue-là aujourd'hui et savoir qu'est-ce que l'Ayurveda en pense. Et ma première question pour le Dr Maini, c'est comment l'Ayurveda l'explique et est-ce que pour l'Ayurveda, c'est une maladie moderne ou non? So I'll let you talk on my first question. Thank you and for your patience, and please make like small chunks.
Sure. So first of all, I will say that I totally agree with you. When we see the worldwide prevalence on diabetes mellitus, it's rapidly increasing. And, it is in parallel with the epidemic of obesity, right? And if you see the estimated figure, it has in the past 2 decades, it has increased 10-fold from like 30 million. Now it has nearly to be 400 millions. And it is the diabetes mellitus is itself associated with the high morbidity and mortality, right? So I think this is a very important to be discussed, to put some insight from Ayurveda, which can help people, how to, take care of themselves and how to prevent or cure the disease. So I will say, if you see the clinical picture, which is mentioned in the diabetes mellitus, it can be correlated with what is known as pramehe in Ayurveda. Okay.
What is known as what? I didn't get that.
It's pramehe. It's Prameha. You can write it down.
Yeah. Okay.
Okay. So pramehe, I will say pramehe so that you can understand it. It is a group of abstinent urinary disorders. So all the urinary disorders and their systemic disorder in which there is a copious amount of urine, okay, and there is the abnormal quality of urine, they comes under the umbrella of prameha. Okay, so we can see that this diabetes and this metabolic syndrome can be correlated with prameha in Ayurveda. Okay, and this is
so just to understand, are you saying that Ayurveda says when you have copious amount of urine and then it's abnormal, then that brings diabetes? Or does it say that diabetes, one of the key symptoms that Ayurveda identifies it with is the copious amount and abnormalities of urine?
Yeah. So see, if we say prameha in Ayurveda, it encompasses the metabolic syndrome, obesity, diabetes mellitus, diabetes insipidus, or you can say hemoglobinuria, proteinuria, anything which has a lot of urine and there is an abnormal quality of urine.
Okay.
That lies in the umbrella of prameha. Okay. So why we are saying that diabetes is like we are going to equate diabetes with prameha, because the clinical picture is same. So when we are going to see the pathogenesis, you will see whatever we are seeing in diabetes mellitus 2, which is associated with obesity. I will explain how it is related with the Ayurveda.
Okay, so I'm going to translate that piece first.
Sure.
But in Ayurveda, if I just recap, in prameha, there's that section of clinical studies, and in Ayurveda, it's associated with that, and it's associated particularly with the fact that we're seeing copious amount and abnormal urine.
Yeah.
Got it. OK. Donc, pour commencer, il y a une section de la médecine ayurvédique qui s'appelle prameha et qui associe le diabète à une des dysfonctions urinaires. Donc, une des premières choses que l'Ayurveda associe le diabète avec, c'est qu'on est en présence de quantité beaucoup plus grande d'urine et d'urine qui est anormale. Donc, ça, c'est la première loupe à travers laquelle l'Ayurveda va regarder le diabète. You can keep going.
Okay. So when we are comparing the diabetes mellitus with the Ayurveda prameha, I will say if we look at the classification of diabetes from the American Diabetes Association criteria, the type 1 diabetes is one when there is a complete insulin deficiency. That is because of the beta cells destruction that can be autoimmune or idiopathic, right? That is the type 1 diabetes now. And in the type 2 diabetes, we say that there is, it starts with the insulin resistance, then it goes through the impaired insulin secretion, and there is a excessive hepatic glucose secretion, and which is associated with the obesity. There are other forms also, like which are because of the drug induced, or because of any exocrine pancreasis disease, or because of the any infection. So when we see the classification in Ayurveda, so this was the, you know, the modern aspect where we see the hereditary one, and the there is a type 2 diabetes, which is associated with the obesity. So when
the type 1 in Ayurveda and American classification is associated with heredity.
Heredity, yeah, that's a genetic factor, yeah. So
Got
if we look at the classification which is given in Prame, so I'm going to quote it from the Shushruta Samhita, a book, which say the first classification they say is there's the Sahaj and the Apatya Nimijjanit. Sahaj means the hereditary one, okay, and Apatya Nimit, if I break the word, Apatya means incompatible or unwholesome food and diet, which is caused because of the unwholesome lifestyle, which is called as the acquired
Diabetes.
diabetes. So the type 2 diabetes, which is associated with the obesity, is completely analogous to what is mentioned as the acquired diabetes in Ayurveda. Okay.
Yeah. Okay. So let me just recap that. So you're saying that in the I think it's Shushruta Samhita, yes?
Yeah.
In the Shushruta Samhita, you're saying that there's the Ayurveda knew 5,000 years ago.
Yeah.
About that disease.
Yeah.
That always.
Yeah.
I'm always blown away by that. I got to tell you, I don't get over this.
You will be surprised to know that the inclusion of the diabetes, okay, is in the Mahagadro, means the diseases which are, you know, which is heterogeneous group of diseases. It is included in that, and even in Charak Samhita,
yeah.
In the Nidanstan, it is elaborately mentioned. So that tells the significance of the disease. You know, it is mentioned so many years ago.
Yeah, so it's been there like forever.
Yeah, it was there forever.
So in the Shushruta Samhita, you have the hereditary one. So it says it's genetic, it's type 1. Today we're calling it type 1. In Ayurveda, it was like twofold, hereditary or the unhealthy one, which Ayurveda back then stated as the acquired one.
Acquired one, exactly.
Got it. Okay. So let me just
sure.
Translate that. OK. Alors, c'est incroyable à chaque fois que j'étudie l'Ayurveda avec des docteurs que je vous présente ici et on geek sur l'Ayurveda et le côté clinique et comment se guérir par l'Ayurveda et guérir notre vie, je suis scotchée qu'il y a tellement rien de nouveau pour l'Ayurveda. Je veux dire, il y a 5000 ans, dans des livres cliniques qui sont mentionnés dans les textes ayurvédiques de médecine, donc la Shushruta Samhita ou la Charaka Samhita, on parle de déjà 2 types de maladies qui donc les ancêtres sont vus du diabète. Donc, il y avait le côté héréditaire de ces anormalités-là. En fait, ce que la classification américaine appelle le diabète type 1, qui est la destruction complète de l'insuline et associée à l'hérédité, et le diabète type 2, qui est la résistance à l'insuline et qui est associée au gain de poids et à l'obésité. Et donc, alors, l'Ayurveda, à l'époque, dans ces manuels-là, identifiait l'aspect héréditaire et identifiait ce qu'elle appelait le diabète, c'était pas appelé comme ça, mais le diabète acquis. Donc, ce qui n'est pas santé est lié à l'obésité. Donc, you can keep, so are you good for my second question?
Sure.
So, can you explain the pathology when you put on your Ayurvedic glasses, do you want to say a couple more words about the pathology when it's type 1 or type 2?
Okay, so when I'm talking about the type 1, that is a
And keeping it simple, because I know for you it's easy, but we're just beginners here.
So I'm not going to read the Sanskrit verses because, then it will be difficult.
I won't. Yeah.
So when I say about the type 1 diabetes, okay, I'll explain everything what I can, okay? So type 1 diabetes, when we say that it is a Sahaj one, right, that the hereditary one, there are two contributing factors to it. One is the Beej Tushti. Beej Tushti means there is some genetic defect in the sperm and ovum, right? And it is stated that there is a study also, I don't remember the link, otherwise I will share it with you, that when there is excessive intake of the sweet taste in the diet.
Sweet rasa, yeah.
Yeah, madhur rasa, yeah.
Yeah.
So it is going to bring the changes in the chromosome, right? So that can give the defect in the sperm and the ovum. And second factor which contributes to the hereditary disorder is the intrauterine life of a fetus. Development is affected by the mother's lifestyle, diet, and the adverse psychological effect. Okay, so I mean to say that if there is a genetic predisposition in there in the child, and that child is taking excess of the madhur rasa or a kapha aggravating food, like which is like high saturated fat, then the child is going to have the diabetes, which we say as the juvenile diabetes, or diabetes at the young age. So what I mean to say, that if a normal child who does not have any tendency of in a genetic, like it does not have any genetic tendency in the family, if the child is taking madhuras, not in excess, but in a nominal amount, then he will not get diabetes, right? So it is very important to understand the family who have genetic tendency toward this disease. They should mind the diet and lifestyle in their family,
Got it. So let me just recap something. I just want to, then I'll translate.
Okay.
So when we look at the type 1, I find it fascinating, Nikhita. I just find it fascinating. So you're saying that Ayurveda, when it looks at type 1, it's going to say the thinking behind it. It's saying that we're looking at a genetic defect. And it happened because the mother, while pregnant, there was too much intake of the sweet rasa, so the sweet taste, and also an adverse psychological effect. How do you link the psychological effect with coming down with a baby that has diabetes?
See, it is not only one reason that the mother is having kind of food in the intrauterine life of the fetus. It is additional factor, okay? And when you are talking about how does the psychological stress have the effect on the baby, is because it imbalances the three dosha, mainly the vata. So if it's the stress, it's the kind of a stress kind of a thing, then it will be vata. If it is the anger, then it will be the pitta.
Yeah.
For the formation of diabetes to happen, there should be interaction of the etiological factors, dosha and dusha. Dusha means the body components. Dosha, you understand.
Yeah.
So when these three interact, that will decide whether there will be a disease or not. So these three should be present for the manifestation of a disease.
So when you say three, the genetic defect, too much sweet rasa, and the adverse psychological?
Yeah.
Got it. Those three. Okay. And then it's going to travel all those imbalances and that aggravation. The pathology is going to start within the mother and travel onto the fetus.
Exactly.
And it's going to come out.
that the child will be vulnerable to diabetes.
Got it. OK, let me just translate that. It's fascinating. OK. Donc, pour le type 1, le diabète type 1, l'Ayurveda le regarde en disant, OK, il y a 3 composantes. Chez la mère qui est enceinte, il y a un défaut génétique, donc il y a déjà une fragilité. Il va avoir, durant la grossesse, trop de consommation, on appelle ça rasa en sanskrit, donc trop de consommation de sucré, de goût sucré. Alors, ça va affecter. Et la troisième patte qui va amener le diabète chez l'enfant, ou en tout cas une possibilité élevée de diabète, c'est aussi un aspect psychologique qui va être handicapant. Par exemple, si la mère, pendant qu'elle est enceinte, a subi du stress, ça va créer un déséquilibre doshique vata. Si pendant qu'elle est enceinte, la mère, elle est souvent dans des colères, puis elle vit énormément des sentiments de colère ou un déséquilibre de ce côté-là, ça va être une aggravation pitta. Donc, ce qui est fantastique, c'est que, et de la même façon, alors, ces 3 aspects-là, l'aspect psychologique, l'aspect, je trouve ça fascinant que l'Ayurveda souligne ça. L'Ayurveda est extraordinaire pour prendre l'individu dans son ensemble. Moi, c'est la partie qui me fait tomber en amour et fasciner et motiver à étudier l'Ayurveda. Donc, on a l'aspect psychologique, on a le goût sucré et on a un problème au niveau génétique. Et ça va voyager dans le fœtus. Et là, on va arriver avec un enfant qui est sujet à une possibilité de diabète. Et si, pendant sa jeunesse, il consomme pas juste du sucré, mais du gras, on va arriver dans une aggravation kappa et on va être en présence, on va avoir une tendance au diabète juvénile. Now, did you want to go into type 2 or you want to say something else on type 1?
Sure, we will go for type 2 diabetes.
Okay, perfect. It sounds so simple when you explain it.
Thank you. So first, I would like you to look into the etiological factors which are mentioned for the type 2 diabetes, which is similar to what we see in the obesity. So I will just read a shloka because it's one of my favorite. Asya sukham swapan sukham dadini gramya adukanuprasa. I will break it. Asya sukham means when there is overindulgence in the you are having a pleasure in the sedentary activities. Okay.
So the shloka, just for reference, the shloka was taken out of
Charak Chikitsa. Yeah, Charak Chikitsa, Charak Sanhita, the sthan. The part is the Chikitsa sthan and the chapter number is 6.
Okay. So tell me again. So when you indulge in what?
If you find a lot of pleasure in the sedentary activities, that simply tells that no exercise, nothing, just sitting. And swapan sukham means sleeping in during the daytime, right? If you are already having 8 hours of sleep or 7 hours of sleep, and again you are going back to sleep in the daytime. So this is not for we are not talking about the kids, we are talking about the normal adult.
Yeah.
And then dadini. Dadini means the curd, which you say yogurt. So excessive intake of curd, right? Then anuprasa, that is the soup of the marshy and aquatic animals. Then you can correlate it with all the seafoods. Okay. And even with the highly saturated fats and all those things, even with the red meat, because that is very heavy to digest. And it is said payansi. Payansi means all the milk and the milk products, right? So when we talk about the milk products, I will take like cheese, because these days I think people are eating a lot of cheese, right? And nav anpanam, which is the freshly harvested grains and all the kinds of food which aggravate the kapha dosha. So these are the etiological factors for the diabetes, which is associated with mainly with the obesity. But I'm saying with the obesity, but when type 2 diabetes, after certain time with the progression, it is converted into the type 1 also, like which
Yeah.
we correlate with the Vataj Prameha also.
Yeah, we'll get back to that because there's the 5-year thing that I want to get back to the other question. But let me just recap before I translate. I want to so in the shloka that you read to me, which was very interesting, the one that finds a lot of pleasure in sedentary activities, I love that, and sleeping during the daytime. And did I hear correctly when you said too much intake of yogurt?
Yeah.
Yeah, okay. So and Ayurveda separates it from the milk products?
It is included in the milk product, but this specifically mentioned the yogurts. Like there are in Ayurveda, it is mentioned how you have to eat yogurt in which season and which time of the day.
Exactly.
But you are not following that guidelines and you are taking curd whenever you want to, then of course it will become a etiological factor for the diabetes.
Correct. And depending on your dosha too.
Of course, dosha.
Yogurt doesn't agree with all of the doshas. Yeah.
Exactly.
So, yeah. And the seafood and fresh greens. That's surprising.
Fresh harvested cereals. Like if I say
fresh harvested cereals.
Like rice, newly harvested rice or wheat, those kind of cereals I'm talking about.
So that they already had identified that as being sugary and then leading to diabetes way back then. Okay.
Yeah.
Got it. Okay. Alors, pour le type 2, il y a un verset, alors en sanskrit, shloka, c'est verset, donc il y a un verset d'un des livres médicaux en Ayurveda, très ancien, un texte ancien, qui dit que le diabète type 2, qu'on appelle de nos jours, c'est la personne qui a beaucoup de plaisir dans les activités sédentaires et dormir durant le jour. Donc, j'ai trouvé ça, j'ai bien aimé. Quelqu'un qui prend trop de yogourt, de fruits de mer, des céréales qui ont été fraîchement moissonnées et des produits laitiers. Les produits laitiers, ça, c'est pas une surprise, hein, on en parle tellement. Comment, et le docteur Maini disait comment c'est rendu un problème. Il y a une surconsommation de produits laitiers. Il faut vraiment ramener ça parce que ça crée un problème. Et avec le temps, le diabète type 2 se convertit en diabète type 1. On va y revenir. Thank you very much. Now, my third question for you tonight was, how does Ayurveda treat it? So we can go more into type 2, which is more prevalent if you want.
Yeah, so I'm going to discuss the pathogenesis of type 1 still continuing that. So because we have just read the etiological factors. So how does it happen? What is so my question is like the one, if everybody is eating curd or if you are eating, then the diabetes will happen to you? No. So this is the only dosha. We talk about the dosha vitiated, right? Now there should be the body component which is also vitiated. Then there are the chances of manifestation of the diabetes. So when we talk about the body component, the main component, main dhatu which is vitiated is the meda dhatu, which is the fat in our body, right? So the interesting thing to note here is the etiological factor which I said for kapha dosha, they are almost similar to the vitiation factors for the meda channel, the channels which carry the fat in our body, right?
Yeah.
They are almost similar. That it is mentioned there that if you don't exercise and take a lot of fatty food, and if you indulge in a lot of alcoholic preparation, then that channel will be vitiated, right? So when first there is the dosha, that is the kapha dosha is vitiated, and it is specifically mentioned that when this dosha is denatured, it will be more in the liquid form, right? The kapha dosha will be bahu drava dosha vishesha, bahu drava shleshma. That means the kapha will change its nature and will become more liquid. Okay. And second, it is mentioned that the med dhatu, the fat tissue which is in your body, will become loose. Okay, will become flabby because of the etiological factors, and it will become copious. It will be abundant. So what do you see in obesity? It is the loose, flabby fat tissue everywhere, over the abdomen, over the chest, over the buttocks, So these are the main two things which happen during the pathogenesis of the diabetes. So, and why the same factors are responsible for vitiating the kapha dosha and the
Meda,
because they have close resemblance in the qualities and the function. Same thing is, and it is not happening over a day or over a month. It takes many I will say years to it start like a year or many years to do that. But if there is a genetic disposition, then it will happen soon,
Okay, so you're saying, so we're now speaking of type 1 diabetes. And for Ayurveda, you're saying to me that Ayurveda says we will see that there will be a change in kapha dosha, which is usually more mucousy. It will become more liquid. And then in the medu dhatus, which is the channel for the fat, and that builds the fat in the body, it will become vitiated and it won't work properly anymore, because if the person takes alcohol and fatty food, then the practitioner in Ayurveda, just by looking at the patient, will see that the fat aspect of the tissues, just looking at the person, will be more abundant, more flabby. Kapha dosha will change, will be more liquid. So, and where it's located on the body, and the practitioner is going to be able to say, we're heading there.
We will see the prodromal signs also, before this disease happens.
Got it.
You will see the prodromal sign, like if there is already a med dhatu dushti, like med is bad in your body, so you will see the med dhatu symptoms, like there will be ati sweat, there will be over sweating, there will be bad smell from the body, the tissues are fatigued, and when there is excess of med dhatu, of course, person will feel fatigue, right? Because when excess of this fat will form, then it will obstruct the part for the other dhatus to form. There will be depletion of the other dhatu, right? And it is the same pathogenesis what is explained in obesity in Ayurveda, that when there is copious amount of the fat, that fat is going to obstruct the vata. Right? That is going to obstruct the vata. That vata will be confined in the abdomen. Okay, so that vata is confined in the abdomen. So then the person will feel hungry again and again. You will see, like you must have seen that all the people who are obese, they feel like eating all the time. That's the phony appetite, I will say, but that is because of the vata dosha in them, which is confined to the coast, and it's making them to eat again and again. And when they will eat again, there is the
because they feel full of hair, right? They feel all the vata, all the ether, all the space is stored in the abdomen.
The vata, ether, is a friend of Agni, when you increase the Agni, the vata increases it, right?
Right.
The same thing goes in the abdomen, and
got it.
When the person keeps on eating again and again, the metabolism becomes slow.
So the Agni become Tikshagni.
You can say kind of Agni is increased. It's Tikshagni for that person that demands more food, right?
Got it. Okay.
And because of that, the Agni becomes Tiksha. It's taking more. But the metabolism is slow. I'm not saying the Agni is Tiksha because it's not getting metabolized rightly. There is apakva, that is the unripe Medha dhatu. unripe fat tissue. Then, because it is unripe, then the further dhatus cannot be formed. You know?
Okay, so got it. So I'll translate that. But a quick question: how does Ayurveda treats type 1 then?
Okay, so it is said as it is incurable, right?
Okay.
Type 1, the hereditary one is incurable. We cannot treat it completely, but we give supportive treatment, you know. See, if somebody, it is mentioned that like if somebody wants to conceive, right, and they have diabetes. I was studying, I came to happen to find a study which says that if a person, a male person is taking the metformin or these mentioned Ayurveda diabetes treatment, that affects the progeny, the progeny,
Yeah.
and especially the boys, they will have some congenital defects in the reproductive organs, you know. So if I say that this is incurable, but if somebody is planning to have a baby, and they should go through the detoxification therapies.
Got it. Okay.
To you know, kind of control the beach dushti, or you know, to just
Okay.
specify it.
Okay, that's one way that Ayurveda treats it. Donc, ce qui est intéressant, et puis je vais le traduire, merci beaucoup de votre patience, parce que des fois, on est dans un sujet, puis c'est difficile de le découper. Donc, en Ayurveda, une des façons qu'ils regardent le diabète type 1, c'est que le praticien va regarder son patient et il va voir deux choses. Il va voir que le dosha kapha à l'intérieur de lui va changer. C'est-à-dire que kapha, habituellement, c'est plus tout ce qui est avec du mucus. Et il va voir que ce soit les écoulements, que ce soit pour les yeux, que ça va transformer comme davantage liquéfié. Et il va voir aussi, il y a 7 dhatus en Ayurveda qui sont les tissus. Et un des tissus, c'est les tissus adipeux, donc qui s'appelle Meda Dhatus. Et le praticien ayurvédique, il va voir, notamment parce que si son patient prend de l'alcool et du gras, mais il va regarder sur le corps de son patient beaucoup de praticiens. En Ayurveda, là, la première rencontre, les premières rencontres, on examine énormément juste par l'externe notre patient, puis on est capable d'identifier beaucoup de choses. Et notamment, il va voir que la qualité du gras sur son patient a changé. Le gras est rendu lousse sur le corps. Et, tu sais, quand les bras ou les jambes, ça devient comme, ça bouge tout seul, le gras, là, un peu comme, je ne sais pas comment, le lousse, là. Donc, et ça va devenir plus abondant au niveau de l'abdomen, au niveau des fesses, au niveau de la poitrine. Et donc, il va avoir certains caractères aussi. Souvent, la personne va se mettre à sentir moins bonne. Ça, c'est le type 1, diabète type 1, et il va avoir beaucoup de fatigue. Et la fatigue vient pour l'Ayurveda notamment parce que la digestion est obstruée et donc la personne a toujours faim. Toujours faim et la digestion est déséquilibrée. Donc, alors, et l'autre chose pour l'Ayurveda, puis, donc voilà. Et donc, c'est important, ces mentions-là. Et donc, l'Ayurveda va voir ça beaucoup plus en avance que notre système à nous. Et ça, c'est une grande, grande spécificité de l'Ayurveda. C'est que l'Ayurveda va identifier la pathogenèse, là, comme le départ de la maladie, dès qu'il va y avoir un déséquilibre au niveau médas, puis au niveau de kapha, et de par le temps que ça se manifeste et qu'on soit dans un chaos, le type 1, ça ne sera pas comme ça parce que c'est déjà incurable, mais le type 2, par exemple, de diabète, nous, notre médecine occidentale, c'est vraiment important de comprendre qu'elle le nomme quand la maladie, puis j'ai déjà fait des vidéos là-dessus, la maladie est devenue manifestée. Là, la médecine occidentale y trouve un nom. Mais dans l'Ayurveda, on va voir les signes avant-coureurs bien avant. Et elle dit, Dr Maini, elle dit, même si on ne peut pas guérir le diabète type 1 en Ayurveda, on peut le supporter. Et par exemple, elle dit, si je sais qu'il y a une femme qui essaie de concevoir et elle a le diabète, on va lui faire traverser des thérapies de détoxification. Donc, do you want to go on to type 2?
Sure, we are discussing the type 2 only, yeah.
Okay, yeah.
So now we have a vitiated kapha, right? And we have vitiated meda, which is copious and it is changed, its nature is changed, it is loose, flabby. So I can say that means there are we can correlate it with the free fatty acid, right?
Yeah.
Okay. So what happens is that when we see the progression now, so after this, the vitiated kapha, because of its etiological factor, it blends with the meda dhatu, because because the body it spreads, the vitiated kapha spreads in the body because the body is flabby, there are flaccid muscles, and when it spreads and it blends with the meda dhatu because of the resemblance in the qualities, and then it tries to vitiate the meda dhatu. Okay, so from kapha meda dhatu is vitiated. Now then it vitiate the masa dhatu. Okay, those are the muscles, mas dhatu, and the clade in the body. Clade is nothing, that is the moisture what we have in our body.
The mamsa dhatu, right? The muscle.
Masa dhatu, yeah. Masa dhatu and clade. Clade is the liquidity, the moisture in our body. That is also one our body component. Okay. So what happens now when the masa is vitiated? There is a congenial atmosphere for the carbuncles. We see that carbuncles, putrefied carbuncles in diabetes, that is because of the vitiation of the, I think it's too deep, I'll just cover it from, yeah. So kapha has vitiated the meda dhatu, masa dhatu, and the kleda. And the function of clade is, normally the function is, it is transformed into the urine. So when everything is mixing up with the mas dhatu and clade, the quantity of clade increase, and once that get vitiated, it is transformed into the urine. Okay.
How do you write clade? I just want to see the French word.
Kleda.
Kleda.
Yeah, clade.
Kleda.
Kleda, kleda.
Yeah.
Okay.
Give me just one question, just so I understand. Give me just one. Hold on. Klade.
Kle.
Oh, okay, sorry. Kle.
Yeah.
Klede. Klede.
Do you want me to put it in chat?
No, I'm good. I'm almost there.
So I am going to type it in the chat.
Translate.
There I go.
Okay, Kleda. Okay, so it has the similar qualities of kapha and ama.
Yep.
And
it's
the swelling of the tissues.
No, it increases or it is obstructed during the swelling of tissue. This is a natural body component. Okay.
Okay.
And through it, when the urine is formed, normally also.
Got it.
It takes the clade away from our body, I'll say that. Okay. So when this is vitiated, then the liquid part of the component goes to the urinary bladder and the kidneys. Okay.
Yeah.
And So now this, because of this, everything what had happened, the liquid amount in the body is increased, right?
Got it.
So that is why the polyuria, that means the copious amount of urination is
Got
there.
it.
Okay, so they will take into the urinary bladder and the kidneys, and after that, after some time, the kapha dosha and the meda dosha will obstruct the pathways of the urine and will manifest the prameya. Okay, then the diabetes.
Okay.
This is like
Got it.
little complicated. But
Perfect. But I'll translate it because it gives us it really, I think it's very instructive. And then we can go into how Ayurveda would treat the type 2 diabetes.
yeah, I just want to add one more thing.
Yeah.
When we are talking about the correlating the dosha classification, we said that the acquired one is the type 2 diabetes, right?
Yes.
Where kapha and pitta are the type 2 diabetes. But when we see vataj one, it can be acquired also, or it can be hereditary also. So I'll explain why vata type is also acquired, right?
Okay. But
So what happens?
typically you're saying Vata is type 1 and Pitta Kapha will have more type 2 diabetes.
Yeah. So
Yeah.
what we said, the type 1 is the diabetes when there is a complete insulin deficiency, right?
Yeah. Yeah.
So what happens as the disease progresses, when there is a kapha prameya, if we don't treat kapha and pitta prameya, it will finally progress into the madhumeya. Okay, that is the subtype of the vata prameya, in which there is a insulin deficiency, right? So if you see all the terminal cases of type 2 diabetes, there is a insulin deficiency. We are not talking at the stage when there is a insulin resistance or there is an impaired insulin secretion. After the diseases progresses for many years, there is an insulin deficiency. That means from kapha and the pitta prameya, the disease had transformed into the vata prameya.
Got it.
Okay.
Got it. Okay. So it was a Pitta and Kapha imbalance, and it muted, like it changed into a Vata aggravation.
Yeah, it has aggravated
diabetes, which may
it can happen in the obesity also, because we talked about that previous, that when there is there is lot of kapha and meda,
yeah.
it obstructs the vata. So the person is flabby,
Yeah.
but there is a vata obstruction, right? That can also give it.
Right.
Or after the time period when the disease progresses, when the treatment was not done, it can transform into the vata prameya.
Got it. Let me just translate. I got it. As best as I can, I got it. So, alors, merci de votre patience. C'est plus spécifique le diabète que je pensais comme entrevue, mais merci énormément de votre patience parce que je pense que c'est très éclairant si vous êtes comme moi puis vous aimez l'entrevue. Alors, donc, dans le diabète type 2, on a même chose, donc kapha qui est vicié, donc le dosha kapha, comme j'ai expliqué précédemment. Et, mais là, il va se mélanger avec les tissus médas, qui est le gras dans le corps, à cause de leur ressemblance. Hein? Kapha, c'est huileux, puis c'est gras d'habitude, puis c'est tout ce qui est muqueux, avec du mucus, mais là, il va se liquéfier, puis il va prendre une ressemblance à celle du gras dans le corps, et kapha et les tissus gras dans le corps vont se mélanger. Et donc, le corps va avoir un excédent de liquide et ça va créer cette urine-là qui est en trop grande quantité et anormale, qu'on identifie dans le diabète. Donc, et elle mentionnait, elle dit, quand on laisse aller le diabète type 2, là, parce que le dosha vata est associé au diabète type 1 et pitta kapha diabète type 2 au niveau des déséquilibres. Il y a des nuances, mais je vous fais ça grosso modo, une compréhension. quand on laisse aller le type 2, là, on passe de la résistance à l'insuline à de l'insuffisance à l'insuline et là, on tombe dans du type 1. So type 2 will become type 1
Yeah.
if you let it go.
Yeah.
Yeah.
From the Apaj and Pitaj Prameya, it will be converted into the.
And then there will be early mortality.
Of course, because then it, at that stage, it is difficult, it is incompatible to the therapies which are mentioned in Ayurveda. We cannot do detoxification for the Vataj Prabha. Now, like you are asking me the treatment. So now we have to be very careful because see, first is that we have to, if I start from the first step, we have to focus on the impaired fat metabolism, right? And second is that in Ayurveda, first management is mentioned that one has to be very scrupulous about what we are eating. We have to leave all the etiological factors. We have to be consistent that we don't eat what is, or we don't do whatever is mentioned in the etiological factor. Because even if we are taking everything, but our etiological factors are there, then we won't get the result, okay?
Yeah.
So now talking about the proper treatment, it is said that the patient of diabetes should be classified according to their physique, right? When I say physique, that means first group is the person who are obese and who are strong and they have diabetes, right?
Right.
And another group is for the person of the patient who are diabetes and who are emaciated, like they are weak, they have low body mass index, right?
Yeah.
So the detoxification which is mentioned is only for the group who are obese, like who are strong, who can bear the detoxification therapies, right? And for the people who are lean, weak, no detoxification should be given to them. They should be given the nourishing therapies, the Brihan therapies. Because if you give them detoxification for the dhatus, then there will be more increase in the vata, okay? And this will be incompatible and will lead to more morbidity.
So quick question. In our Occidental medicine, is that what we do, or you find that obese diabetes people, they go into detoxification? The emaciated people, you find them doing detoxification and they don't know what they're doing just because they have diabetes. Do you understand what I'm saying?
Yeah, many of them are doing this. See, there are detoxification. That means they can take they don't take detoxification. They should take therapies which are nourishing for them. If they are taking basti, but like they should not go for Vaman Virichan. Completely contraindicated. Okay.
So that's what I'm asking you.
Yeah.
Are you witnessing, let's say in Canada, that you have some emaciated, thin people that have diabetes, and you see them going?
It's a bad result. Recently I have a patient, I don't want to name anybody, that person is Canadian, and they went to India for the detoxification therapies. And when she came back from India after like 21 days of detoxification, she got arrhythmia. And it was not a very simple arrhythmia. It was really, really bad for her. And I told her, please never ever take the Niruhan Basti, the decoction Basti, because it increases the vata. And if you see the recommendation, it is specially mentioned that the people who are weak, sheen, old, they should not. So it is very important that they should be assessed properly for the detoxification therapy.
That's what I've seen a lot. People improvise, and from what I've seen in my studies so far, they don't have the ojas.
Yeah, that get
to go into detoxification, and they just go in there and they just get lower.
Yeah, people are madly taking detoxification, that they think that they are taking the toxins away. But see, toxins are built through our Agni, right? What we eat. So if you don't have capacity, or your body does not have strength for detoxification, just manage everything with your diet and the Rasayan therapies, right? Rasayan rejuvenation does not mean detoxification. Detoxification like even I cannot take detoxification, frankly speaking, So
Yeah.
it's really bad.
Okay. Okay, so let me just translate that. So if you're obese and strong in Ayurveda, you're going to treat by detoxification. And if you're diabetes, but you're very weaker and emaciated, then there will be no detoxification. You will be only in the treatment therapies. And what would be the treatment therapies?
So we can choose the nourishing therapy in the diets, in the herbs, and we can give the, if you're talking about the enemas, then we can give the Yapan Basti. There is a specific mention of Yapan Basti. There are different ingredients which are not very harsh like decoction basti. So there are different level of nourishing therapies which we see according to the Agni, like how the patient's metabolism is there.
Okay, so let's just look at a couple of herbs in 2 seconds, okay? But just if ever we could name some herbs that are found in Canada and easy to get, or, they could add in their food or any practice or ritual, that would be very helping. Alors, le Dr Maini expliquait que la première chose que le praticien ayurvédique va conseiller au niveau de quelqu'un qui est diabétique, alors, en Ayurveda, on classe les diabétiques de 2 façons, celui qui est obèse et fort, et la deuxième catégorie, c'est la personne qui a le diabétique, et la deuxième catégorie, c'est quelqu'un qui a le diabète, mais qui est émacié, qui est mince. Et donc, alors, quelqu'un qui est obèse et fort, on va détoxifier. Donc, on va vraiment retirer, purifier tout ce qui est ingéré. Et la deuxième catégorie de personnes qui a le diabète et qui est émaciée, cette personne-là, on ne va pas subir de détoxification, mais on va aller davantage nourrir et des thérapies pour nourrir davantage. Et là, ce qu'elle disait, c'est qu'elle disait qu'un des problèmes dans notre façon de voir occidentale, puis même au Canada, les gens se lancent dans des détoxifications pensant, je vais aller regagner de la santé. Mais il faut comprendre, en Ayurveda, c'est très encadré, une détoxification. Ça ne s'improvise pas tout seul. Tu ne peux pas te tirer dans toutes des détox qui passent partout. Et elle disait que c'est vraiment un gros problème puis un mal de se lancer dans une détoxification quand tu n'as même pas le système immunitaire pour être capable de le prendre. Fait que quand tu vas dans une détoxification, il faut que ton système immunitaire soit déjà à un certain niveau parce que sinon, tu vas aller te tirer à terre. Et moi, je pense toujours, c'est une parenthèse, mais je pense toujours I'm just making a French caveat, au psychologue très connu, Corneau, qui avait fait un jeûne alors qu'il était dans son cancer. Et il avait il avait donné une entrevue, puis il avait dit, j'aurais jamais dû suivre un jeûne. À l'époque, je me sentais toute bien, puis éthérique, mais le docteur m'avait dit que je n'étais pas en condition pour le faire. Je voulais absolument le faire, mais ça m'a amené plus bas, puis je n'aurais pas dû le faire. Donc, c'est pas exactement la même chose, mais c'est important quand on fait des choses qui sont plus importantes au niveau clinique. Non, ça ne s'improvise pas comme ça. On est rendu avec madame, monsieur, tout le monde qui suggère des jeûnes, puis qui suggère, ça doit être encadré, là. Puis ça doit être spécifique à vous. Donc, I was just mentioning the story about a famous psychologist in Quebec. His name was Guy Corneau. And if I recollect the interview correctly, he had gone, it's not exactly the same, but he has gone to fast while he was in cancer. And he said that his doctor said, no, you should not do that. You don't have, the ojas. You don't have like the vitality to go in fasting. And he said, oh, but I'm feeling so elated and so good and etheric. And he said afterwards, I should have not taken it.
Yeah, so this comes under the Langan therapy, fasting or detoxification. And, the patient should be correctly assess whether this is going to suit them or not.
Absolutely.
Yeah.
So question 4, Dr. Maini, is there any herbs or practices
Okay, yeah.
that
So I'm going
your
to tell
best
you.
advice if I was your cousins and I was looking
I'm
for?
going to tell you further because only detoxification is not possible, right? And it is specifically said in Ayurveda, Shanshodhan na varti ya pramehi tasya kriya shanshamni prayoja. That means those patients who are not eligible for detoxification, even if they are obese, okay, then we should perform the pacification treatment or the elevating therapies, right? So when we then it is further elaborated what comes under that. That is the mantha kashaya yakchunalaya. Okay, so there is mantha, that is the gruel, like a thin porridge of the different kind of corn with the water. Then there are decoctions which I'm going to name afterwards. Then barley. Barley has given a lot of significance in the treatment, whether it's a treatment or in the for the preventive aspect or the curative aspect of the diabetes.
How do you write barley?
Pardon?
How do you write it?
Barley?
Barley, yeah.
That's Barley.
Oh, barley, correct. I know barley. Okay.
Yeah. It's a very good, amazing food. You know, it has hypoglycemia effect. Then it has lipid lowering effect. This should be the main ingredient in diet if you are pre-diabetic or you are diabetic.
Wow.
You have type 1 or type 2. So you can mix it with the honey and you can take the powder form, or you can prepare the take it in the roasted form, in the salad form, or you can make a gruel or porridge out of it. You can make a savory pancakes because we don't have to take the milk for when we are talking about the type 2 diabetes.
Okay,
Right?
but you could make a barley soup.
You can make barley soup.
Or you
I'm
can...
going to go in detail for the diabetes diet.
Okay, but just quick question. When you say the porridge, you mean oatmeal?
No. See,
No. Okay.
oat is fine because they are, if you look at the group of the oat is fine. But when you mix it with the milk, what you get in Tim Hortons, it's incompatible.
Okay.
Oats are good because they have a ingredient called inositol, and which is kind of managing the cholesterol level in the body. So
So when you were saying about the porridge, you'll explain.
You can have porridge for the. Are you talking about oats and barley?
Okay, no. When you're talking, are you going to explain like the decoctions and the barley?
Yeah. I'm going to explain the decoction also.
Okay.
So I said these are the important things. Further, I will explain for the diet part also. So when I'm talking about the decoction, so there is one decoction which all the diabetes patient can take, which consists of the triphala. You know what is triphala, right?
Yes.
The daru haldi.
Amalaki, bebitaki, and aritaki.
Yeah, that is the triphala. Then it should be taken along that. You can add daru haridra, that is the berberis arista. You want me to write it?
Yeah.
Then you can add one more ingredient, which is musta. Musta is Cyprus rotundus.
Are they available in Canada?
Yeah, you can easily get them. Okay, if you're talking about Canada, then I will give you the very simple decoction or the herbs. You can take the amlaki ras, that is the Amlica officinalis juice, mix turmeric into it. Okay.
So you're saying amla juice?
Amla juice, it should be fresh. It should not be bottled with preservative.
Okay, you can find that in Canada, yes?
You can find that in Canada, or you can have the powder form of
amla powder, and then you would mix it with what?
Turmeric.
With turmeric. Yeah.
Okay, and then mix it with the organic honey. Be sure that there is not extra sugar added to it.
Yeah.
Right? And you can take that.
You would take that like a teaspoon once a day?
It should be taken after meals twice a day. Okay. And then you can also take, there is also one more thing which is mentioned, that you soak the barley in decoction of triphala, okay? And next morning, mix it with the honey and take that.
Soak barley with triphala.
Triphala decoction.
Yeah.
Let it stay there overnight, and next morning you can have it with the honey. And this is one of the very good nourishing food mentioned in Ayurveda.
Where can you write to me the proportion after the interview?
Okay, yeah.
If ever you know the quantity, and I can join.
Maybe we can have another discussion about the herbs and the quantities, and
we can have another. Yeah, we can have
usually
another.
I don't tell it over online, because sometimes people they don't understand for which constitution I'm taking.
Yes.
And
yes.
that self-indulgence or this is not a very good idea.
No,
But
we're
yeah,
not saying
so
that.
these, yeah, the one which I mentioned, they can be taken by all yeah, all kind of diabetes. And one more thing I would like to mention is the guruchi swaras, like the juice of giloy guruchi. Have you heard about it?
No, is it available in Canada?
Yeah, you can easily get the powder. There are stores which are there are organic stores where they are selling the herbs.
I'm going to stay for triphala for tonight because it's so easily attainable.
But see, triphala, if you are a pit prakriti, I will definitely say don't take triphala. It is not suitable for pit prakriti if taken for very, very long time. For 1 or 2 days, it's fine, right? But if you are consistently using triphala and the person is pitta prakriti, then the ushna gun from triphala will rise the ushna gun of pitta prakriti.
Okay, but you were saying that it's good for all type of diabetes.
Yeah.
But of course, it should be supervised as for the length and the
quantity. It has to be supervised.
Okay, got it.
If you talk about all types, then I think amlaki, the amla, the Indian gooseberry juice, or what you say, amlaki professionally, that is the best because it works for the
okay.
three
Alors,
dosha.
parmi les façons de traiter le diabète en Ayurveda, c'est une des façons, c'est parce que certains patients, comme je mentionnais, on n'ira pas dans la détoxification, on va chercher à pacifier le déséquilibre. Et donc, il va avoir les décoctions, il va avoir l'orge. Elle m'a longuement parlé de l'orge. Barley, c'est l'orge, hein, Dan? Je ne me trompe pas, hein, dans ma traduction? Dan? Barley, c'est bien orge, hein? OK, c'est ça. Donc, je voulais juste être sûre de ne pas me tromper. Et donc, elle disait que l'orge, c'est un super aliment. Donc, investiguer, parce que lorsqu'on a un diabète, elle dit pré-diabète, diabète, on devrait se lancer sur l'orge. On peut le faire dans des soupes, on peut le faire même dans des crêpes, mais on va se tenir loin du lait. Donc, on va trouver des recettes avec de l'orge. Et elle disait, bon, les décoctions et des espèces de crèmes. Alors, on va en parler. Mais une des décoctions qui est très prônée par l'Ayurveda quand on a le diabète, c'est avec le jus d'amla ou encore l'amla en poudre. Ça se trouve au Canada très facilement. On va prendre de l'amla en poudre, on va ajouter du curcuma et on va ajouter du miel organique. Et on va prendre ça 2 fois par jour. Il ne doit pas avoir de sucre dans le miel. Et on va prendre 2 fois par jour après les repas. Évidemment, on ne dit pas ça ici ce soir pour que vous fonctionnez de manière non supervisée. Vous devez toujours travailler avec un praticien ayurvédique. Dr Nikhita prend des praticiens ayurvédiques et il y en a de plus en plus. Moi, je vais pouvoir commencer à travailler avec des gens en décembre, mais des docteurs ayurvédiques, il y en a que vous pouvez chercher, il y en a de plus en plus. Et ça doit être encadré. Parce qu'il y a toujours une question de votre constitution à vous et être sûr qu'on adapte bien. Mais je veux que vous sachiez que c'est intéressant parce que c'est typiquement une formule, celle que je viens de parler avec le jus d'amla, qui fonctionne pour tous les types de diabète et de diabétique. Et elle disait aussi qui a une décoction avec de l'orge et avec du triphala. Et le triphala aussi est très considéré quand on a le diabète en Ayurveda. Anything else you wanted to ask, to say, sorry, to add?
Okay, so it would be, yeah. So then,
Anything else about the herbs, or do we go with if we want to prevent the diabetes, what would Ayurveda recommend?
yeah, for Vata diabetes, I want to mention that we don't give the direct herbs to them. If we have started, we have like I mentioned that when Vata is secondarily affected, you know, it is affected, aggravated because of the kapha and pitta. So when we see if there is a kapha aggravation, then we give the medicated oil, which is processed with the kapha drugs, you know, to reduce the kapha. So we give medicated oil, right? And if there is association of pitta with the kapha, pitta with the vata, right? There was a pitta prame and then it is transformed into vata prame, or you see the pitta and vata symptoms together. Then in the correction, we have to use the medicated ghee, which is processed with the anti-pitta herbs like ushi, chandan, then haridra, like turmeric.
Okay. So you're saying that if it's a kapha vitiated diabetes, then you're going to go with medicated oil.
With if that is vata. No, see, if there was only kapha and pitta, let's start with the kapha. If kapha is vitiated, right, and the person is obese, we will give him the vaman, right? Okay. If we cannot give him the vaman, then we will give the pacification decoctions like triphala, what I mentioned, daru haridra.
And the vaman is the medicated oil.
No. Vaman is not medicated oil. Before Vaman, we give oleation therapy. If Vata, now we are talking, we spoke about Kapha and Pitta. Now we are talking about the Vata Prame. The Vata Prame is coming to me, okay?
Yeah.
And see that they are associated with the Kapha also, right?
Yes.
Then I will give the medicated oil. And if I see the Vata patient is associated with the Pitta, then I will give him the medicated clarified butter.
Okay, got it. The ghee. So, okay. So depending on what is vitiated, which dosha is vitiated, it will either go with the decoctions, or we could go with the medicated oil, or the
medicated ghee. Yeah.
Yeah, got it. Okay.
Yeah.
Okay. Alors, dépendamment quel dosha est aggravé, on va aller aussi soit avec les décoctions que j'ai mentionnées, soit avec le beurre clarifié qui est un ghee. Mais en Ayurveda, le ghee, on va le rendre médicinal. Donc, on va y ajouter des herbes et des propriétés. Et ça, c'est quand on a un diabète qui est aggravé au niveau du dosha pitta. Donc, on va donner un ghee, mais un ghee médicinal avec certaines herbes et une composante vraiment soignante. Et donc, dépendamment, en Ayurveda, quel est le dosha qui est aggravé et le type de diabète, on va y aller avec des herbes, avec des décoctions, avec des huiles ou avec un beurre clarifié médicamenté. So, anything else you wanted to say, or we go with a prevention?
I think we should go with the prevention now because that's a very big topic. Yeah.
Yes. So, so what does Ayurveda recommend in prevention? Like some specifics that you've seen.
See, if the person has already, he's pre-diabetes, then he has to follow the same treatment pattern what we give for the diabetes patient, right? Right. So if there is a genetic disposition also, genetic tendency also, then also we have to follow the same guidelines. So prevention, it is clearly stated that whatever mentioned in the etiological factors which aggravates kapha should not be taken, right? And secondly, it is very important to have any form of exercise. Okay, it is very, very important for people who are pre-diabetics or they have a hereditary tendency, then they should do some kind of exercise according to their threshold, right? So in Charak Nidanstan, in Charak Samhita, it is mentioned the people who have aversion to bath, aversion to exercise, and who have fatty deposit, like who are obese, can easily get the attack of diabetes. So then we have to follow a very good lifestyle regimen where person is bathing, he's doing some kind of exercise, right, according to its own capacity. And in Shushu Saita, it is mentioned the people who walk, who do the chankraman, who does the walking.
Yeah.
And it is specifically mentioned that the people who cannot afford the treatment, right, who cannot afford the treatment because of whatever reason, they should walk, and they should, like, it is given the kilometers, it is equivalent to like 1200 kilometer in a year. So
Okay.
it should be average like 6 to 7 kilometers per day.
Yeah.
So I'm not stating that anybody who has diabetes should start 7 kilometers today.
No.
They should build it up, they should
Yeah.
build it. Like if they are
7 kilometers per day.
yeah, I
wow.
have seen so many patients who have the HB1ACL13, and they didn't take the metformin or insulin, and they started working on their lifestyle, and like within it is not immediate effect, it takes some months to get it, but first it was like 9 and then it is to 6. So you have to build it up. Like one day you start with 1 kilometer walking, you will stay with 1 kilometer walking for a few days, several weeks. When you become comfortable, then increase it, make it 2, then make it 3. So there are guidelines for exercise also. You cannot exercise like after taking food, right?
Right.
There's things to talk about. So exercise should be done empty stomach, so that you can get benefits through exercise.
Yeah, perfect. Let me just translate that. Alors, dans l'Ayurveda, merci encore de votre patience. Hein, c'est un sujet plus complexe que j'anticipais. Mais donc, alors, pour la prévention, Dr Maini mentionne, elle dit, donc, les textes sont clairs, que vous soyez prédiabétique ou diabétique, on va suivre les mêmes guides. Et alors, l'Ayurveda va mettre son attention sur tout ce qui aggrave kapha. Alors, tout ce qui aggrave le dosha kapha, on va faire attention et on va avoir ça dans la mire et vraiment veiller à pacifier kapha constamment. Donc, si ça vous intéresse, vous avez juste à googler diète kapha Ayurveda et là, vous allez voir les aliments à faire attention et les aliments qui aggravent kapha et les aliments qui sont corrects pour kapha. Et donc, et dans les textes, on mentionne les textes ayurvédiques de faire l'exercice en lien avec ses capacités. Et on parle dans les textes ayurvédiques que à chaque fois qu'on a une aversion pour l'exercice, c'est presque comme ça qu'est décrit le diabétique dans les textes. Et donc, dans les anciens textes, on parle beaucoup de la marche et on dit que celui qui a de l'aversion pour l'exercice, justement, devrait s'intéresser à la marche et marcher beaucoup. Et les textes sont très précis et c'est mentionné même que la personne devrait marcher l'équivalent de 1200 km par année, ce qui fait à peu près 7 km par jour. C'est fou, là, il y a très longtemps, on mentionnait ça. Et elle dit, ça prend des mois à mettre en place. On ne commence pas demain à aller marcher 7 km, mais on commence à marcher petit à petit. Puis elle a dit qu'elle a vu des gens ayant le diabète type 2 ou un prédiabète, puis vraiment améliorer leurs conditions avec ces deux points-là pour prévenir. Donc, une diète, pour pacifier kapha et de marcher beaucoup, de plus en plus, et de bâtir sa pratique à marcher parce que c'est accessible pour tout le monde et c'est facile. So, I'd like to, anything else you wanted to add, or can I ask you my sixth question about why does Ayurveda makes this difference, like if you had it less than 5 years and after 5 years, why is that?
The pathogenesis of diabetes, right? If person has diabetes for 5 years, that means that it depends on the temporal factors, like what age is which age is he, and what are the body constitution, and what are the environmental factors.
Yeah.
So if a person has kapha prameya, it starts with the kapha prameya. I'm just assuming that, and with time, you know, the kapha will get shed. There will be depletion of kapha with age also, or because of the factors, if there are factors that the person is taking more of pitta diet, then it will transform into the pitta prameya, right? And further, as the disease progresses, there will be the kapha and pitta depletion, kapha and pitta shade, and then the disease, the vata will get aggravated in the body because of the depletion of kapha and pitta, and vata will get aggravated, and then that aggravated vata will take the important dhatus like oj or lasika or vasa into the bladder, and that will be released in the urine. And also, when vata prameya happens, that means that decreases the essential essence of the body, which when there we are talking about the oja, right?
Yeah.
So it depends, like it comes after the assessment also, like what stage that person is, what kind of
Let me
constitution.
just translate that and then we'll go to the last question. Thank you. So, alors, ce qui se passe, c'est que l'Ayurveda tranche, fait une espèce de ligne. Quand on a le diabète type 2, si c'est après 5 ans, ça risque de devenir incurable et beaucoup plus difficile à ramener. Et donc, se transformer en type 1. Et pourquoi on explique ça comme ça avec cette fameuse idée du 5 ans-là? C'est que ça commence, à travers les lunettes de l'Ayurveda, le diabète commence avec un déséquilibre de kapha et un déséquilibre dans la composante des tissus graisseux adipeux. Et donc, elle dit, kapha va s'aggraver. Après ça, pitta va s'aggraver aussi. Puis là, vers la fin du cycle, c'est vata. Et à un moment donné, c'est le système immunitaire qui ne pourra pas tenir tout ça. Et c'est pour ça que plus, en Ayurveda, c'est clair, et c'est ce que j'apprends aussi dans mes études, plus on laisse des symptômes s'installer, plus c'est difficile à traiter puis à guérir. Donc, c'est pour ça que la prévention est si cruciale en Ayurveda. C'est pour ça qu'on s'examine tous les jours dans nos rituels. J'ai parlé des ongles, de la langue, les cheveux, les yeux, les selles, donc la couleur de l'urine. Alors, on fait ça tous les jours, puis on ramène constamment dans nos journées pour retrouver l'équilibre, justement pour ne pas laisser les doshas déborder. Puis là, se ramasser avec un dosha qui est parti, et là, on n'est plus capable de ramener parce que ça a eu des répercussions dans le corps, ça s'est déplacé dans le corps, et là, c'est les 3 doshas, et c'est le système immunitaire après qui décroche. So, I would like to let everyone know here, as we're closing our interview, if they want to consult with you, can you tell us how they can reach you? And because some of the people that are listening to us speak English, so.
Okay, so yeah, you can, I can provide my email ID. You can, text me, message me. And
yes.
Then according to that, I can set up an appointment, which we can do over the Zoom or any other app. And then we can discuss, like I can do the consultation, which is usually like for 1 to 2 hours.
Yes.
And then I can tell about like how they have to go further about it.
Okay, perfect. And
so
then
I mention it in the chat. Would you like me to mention that my email ID in the chat?
Yeah.
Okay, I'll do that.
you can put the email address and I'll translate and let them know and say it in English as well. Donc, alors, vous pouvez consulter avec Dr Nikhita Maini pour votre situation personnelle sans problème. C'est à travers, évidemment, des visioconférences. Et la rencontre initiale, comme j'ai mentionné, de 1 à 2 heures, puis après, on va pouvoir commencer à assister avec votre condition à vous. Et la meilleure façon de la joindre, c'est par courriel. Et je vais vous donner votre courriel. Alors, c'est Dr Nikhita, S-A...
I am sorry, the spellings are wrong. I'll type again.
Not a problem. I think I have it in my cell phone because we've exchanged email. Alors, je vais vous donner son courriel pour celles parmi vous qui aimeraient la joindre. Alors, ça va être la meilleure façon de la joindre et je vais aussi mettre avec la vidéo. Donc, quand la vidéo va être terminée, je vais mettre le texte et le courriel. Donc, le email est... alors, je vous donne ça tout de suite. Alors, DRNIKHITASACHDEVA Donc, Dr Nikhita, SACHDEVA Donc, je mettrai le courriel avec le texte. I will put the email with the text after our interview. And I wanted to thank you very much for this interview. We've learned a great deal. Je remercie tout le monde d'avoir assisté, Dr Nikhita, parce qu'on a appris beaucoup. And I will leave you with the final words, which I will translate.
So it was a great pleasure to be here. And, I'm very thankful to you so that I could share my knowledge of traditional Ayurveda medicine with you all. And I hope this is helpful for people who have diabetes if they take this seriously, because we have spoken about the diet and lifestyle, which is very important if we want to manage the diabetes. I understand that people are taking the, allopathic treatment, which is also important, but to prevent the complication and, the morbidity in diabetes, it is very important that we put some focus on the diet and the lifestyle. And herbs are, they are also easily available, right?
Perfect. So let me just translate that. Alors, Dr Maini disait en mot final, elle disait, vous savez, oui, il y a les médicaments, mais on le dira jamais assez. Puis des fois, ça a l'air banal. Des fois, c'est comme on veut même plus l'entendre tellement que ça a l'air simpliste. Mais le focus, c'est sur la diète. Le focus, c'est sur le style de vie. Et les herbes aussi qui sont disponibles et qui peuvent aider grandement. Donc, voilà. Thank you very much. Merci à tout le monde. It's been a pleasure, and I'll get back to Nikhita tomorrow.
Okay, thank you so much.
Merci tout le monde. Bonne soirée tout le monde. Bye bye. Merci.
Have a good night.
Good night.